role is that I'm a knowledge broker. I have information that comes in, and that's from a wide range of resources, so it's about how I share that. So I would say that I'm often the first line of contact for people, particularly if they've got research inquiry, clinical audit or practice evaluation. Because I don't do any direct patient care, I really do need to connect and communicate with those that deliver the care within the organisation. I run a number of training workshops. This year though, I've been really mindful of just how stretched staff are. Each month I offer to come out to the workplace to sit and have a coffee break with staff. What we do is we look at something that's topical in the news and what does it mean to us in practice. Staff have really valued the opportunity to be able to sit and reflect in a very constructive way. I guess ultimately what I want to do is just inspire people to be able to search out evidence, connect evidence and apply that to practice. For me, working very much behind the scenes, it's really important that I lead and develop people, because our practitioners are the ones that connect to our patient care, and I firmly believe that happy, supportive practitioners deliver the very best care.
My role as a sister on the children's wards and in children's outpatients is to manage the staffing, to manage training and development, to make sure that children are seen in a safe and treated in a safe and competent environment. When I took over Acorn Ward just over 2 years ago, I was roughly about the 8th charge nurse they'd had in 10 years, and we also, very shortly after I joined on there, had lost 2 members of staff, one to a cancer diagnosis and one to a sudden unexplained death. The staff had worked with those staff for a considerable period of time, 10 years, so it was really quite a hard and difficult time to maintain morale, to keep the staff going, to keep the staff functioning on a safe level. I sought advice how I could keep them going, how I could support them, brought in occupational health, brought in pastoral services, managed to arrange for the entire ward to go to one of the girls' funerals. So it was a challenging and interesting time. I think that if you treat your staff with respect, with compassion, with empathy, then they will do their very best to give you back the best that they can. Inspiring people and showing positivity encourages them to take the service forward, and I feel that they've got a voice and they can come up with good ideas to take the service forward.
So my job mainly involves working on our high dependency unit and our intensive care unit to help people with starting their recovery early after either a major accident or a major illness. Early on in my career, I probably would have never thought I would have ended up working in intensive care. I think I came into physiotherapy wanting to do the traditional thing of working with athletes or sports people. But at 21, landed my first NHS job, was working on intensive care unit and just fell in love with it straight away. And then still going strong 9 years later, it's coming to work to really help people kind of put their lives back together. There's lots of variety, there's lots of highs and lows working in intensive care. It's quite a high pressure environment, so it's important to be a really good team unit. One of my philosophies with working in clinical practice is really trying to involve the patient in the teaching process themselves, because they're able to contribute an awful lot, and most patients feel that they gain from knowing more about what's going on rather than it being a very clinician-patient separate type of relationship. So I really try and pride myself on working with junior staff whilst they're seeing their patients, and it not just being you sit in a room talking through their development. So you learn by doing, and I think most people benefit from working in that way. It's just even more inspiring to keep doing the right things, and it's a really nice reward for something that I didn't expect to be nominated for at all.